Presentation by Selena Troop. History of present illness. The chief complaint was the patient comes to the clinic because I still have this sore on my lip. Ms. P, a 64-year-old retired PE teacher and coach who has been in good health until now, presents with a persistent sore on her upper left lip. This issue commenced about a week ago, marked by the onset of nausea and the appearance of a sore. She visited the clinic 3 days ago and was prescribed Zofran for the nausea and valcyclovir for the sore on her lip. Despite treatment, the sore has not improved, and the patient reports no significant alleviation from the medications. The sore has remained localized to her upper left lip without spreading. There's no specific incident or event she can recall that might have triggered the sore's appearance. Ms. P denies any history of similar symptoms or recent illnesses that could have been related to this condition. Also, the nausea has went away as well, so that's not even a concern anymore. It's just the lesion on the upper left lip. Pertinent past medical history. She was diagnosed with COVID in 2021. Only injury was she had broken her left wrist during a basketball game in 2007, but it did not require any form of surgery. Immunization status, she is up to date on all her childhood vaccines, as well as COVID, pneumonia, shingles, and the flu. Past surgical history, the only surgery she's ever had was a hysterectomy in 2001. Social history, education level, she holds a bachelor's degree in the study of human movement. Her personal interests are she likes to play basketball, has been a basketball coach almost her whole life. She is a retired PE teacher, but still tries to coach at local recreational basketball. Lifestyle, she no longer gets the exercise she used to, but she likes to go back after the holidays to going back to getting her regular exercise. She used to be very active when she was still working because of the type of work she did, but now she's pretty sedentary. She denies any smoking, drinking, or any form of drug usage, and she can perform all of her own ADLs independently. Medications, the one-a-day women's vitamin she takes daily, and during her previous visit she was prescribed Zofran 8 milligrams every 8 hours as needed for nausea and vomiting. She has it on hand but states she no longer needs it. Review of symptoms. General, she denies any fever, fatigue, or chills. Eyes, denies visual difficulties, visual changes or pain, does not wear any type of glasses or contacts. ENT, she denies any congestion, cough, sore throat, nasal drainage, ear pain, or discharge. Endocrine, denies any changes in appetite, thirst, or urination. Cardiovascular, denies any edema, chest pain, dizziness, shortness of breath, or loss of consciousness. Gastrointestinal, patient has some issues with constipation and drinks prune juice if she has not had a bowel movement in more than 3 days, but she denies any reflux. And she had been having issues with some nausea and vomiting that is, pretty much subsided at this point, but still has Zofran just in case. Genitourinary, denies any issues voiding, no foul odors, no blood in the urine or flank pain. Heme and lymph, denies any unknown bleeding or bruising. Integumentary, she states the lesion to the upper lip started more than a week ago, denies any other types of rash, wounds. Neck, denies any neck pain, stiffness, or inability to move her neck. Neurological, she denies weakness, numbness, falls, balance issues, but she has had, a headache or so in the last 2 weeks. Musculoskeletal, denies any swelling, but does have some joint pain in the morning when waking up. Psychological, denies anxiety, depression, hopelessness, or hallucinations. And respiratory, she denies any cough, congestion, shortness of breath, or difficulty breathing. Physical exam. General, the patient appears well developed, well nourished, and in no apparent distress. Eyes. Eyes have white sclera. Pupils are equal, round, reactive to light, with extraocular movements intact. Brows, lids, and lashes are unremarkable. Ears, tympanic membranes bilaterally intact, no bulging or erythema noted. Nose, normal nasal cavity, nares are patent and symmetric bilaterally. The septum is noted to be midline. Mucosa without edema or inflammation, and no clear or purulent discharge. Throat. Mucous membranes are moist, bilateral, tonsils are normal without swelling or exudate. No drainage was noted. Cardiovascular. Heart rate is within normal limits. Rhythm is normal with S1 and S2 noted. No murmurs, rubs, gallop, or extra heart sounds noted. Neuro. She is alert and appropriately oriented. Neck. Interior cervical lymph nodes palpable and pea-sized, non-tender. Neck supple with normal range of motion, and thyroid has been palpated and is within normal limits. Integumentary. Lesion noted to upper left lip. No drainage noted. Lesion covered with crusting. Adequate skin turgor. Skin is warm and dry. Heme and lymph. No unusual bleeding or bruising observed. Genitourinary. Refused assessment. Gastrointestinal. Soft and non-tender. No masses noted. Non-tender. Bowel sounds are present in all 4 quadrants. Cranial nerves. They're all intact. Patient with normal muscular tone. Full ocular range of motion. Reflexes are intact. No hyperflexia, hyporflexia, or clonus was noted. Sensory. Sensation for smooth, rough, hot, and cold, all appropriate in all extremities. Motor functions within normal limits. Gait normal and steady. Respiratory. Respirations are even and unlabored. Lungs clear to auscultation bilaterally with good. Air movement. No stridor, crackles, rubs, or wheezing. Musculoskeletal. Movements are symmetrical. No weakness was noted. Psychological. Alert and oriented types 4. Normal mood and affect. Patient is engaged with examiner appropriately and behavior is appropriate. Labs and diagnoses. No labs or diagnostics are currently necessary at this time. Differential diagnoses. First one was herpes viral. Herpes lesions usually last up to 10 days, most often occur on the lip, tongue, roof of mouth, or gums. Patient was treated for this on the previous visit, and the sore did not go away. She was given the valcyclovir and had noticed no improvement, and it went from being just a small lesion to a honey-crusted lesion after taking the medications. Varicella, also known as chickenpox, could have been a plausible diagnosis. They do consist of crusted lesions, but would highly unlikely to cause only one lesion on the upper lip. Also, many times it also includes malaise, fever, which the patient had not experienced anything else except for the one lesion on her upper lip. Atopic dermatitis, also known as eczema, also could be a possibility, but since it was only one localized lesion, it was pretty easy to rule out. It generally is a chronic condition with dry, itchy, inflamed skin. And this one was not dry. It did have the honey crusting because it had some drainage. It wasn't itchy. It was slightly inflamed, but was easy to kind of rule out that that was not the issue. The final diagnosis we came up with was impetigo, the pathophysiology of the problem. Impetigo is primarily caused by gram-positive bacteria. The pathogen associated with impetigo is commonly associated methicillin-resistant Staphylococcus aureus. If not treated appropriately or promptly, it can progress to cellulitis. Explanation of the diagnosis. Impetigo is a skin infection of the epidermis and targets only the keratin cells within the epidermis. Impetigo presents as erythematous plaques with yellow crust. It is highly contagious and typically appears on the face. Treatment. The treatment ordered for the patient was mupirocin 2% ointment applied 3 times a day to the affected area for 10 days. An oral antibiotic, which was Bactrim DS 800/160 milligrams 2 times daily for 10 days. This treatment follows the standards for treating this condition. Patient was also asked to return to the clinic after completing the course of antibiotics and the mupirocin ointment to just make sure that everything is gone and no further treatment is necessary. And these were all references that were used for my slideshow. And there is my signature and the date. Thank you.